Hello, my name is Ravi Vij. I'm Mike Cancer Haven, and today within our Conversations with Cancer Experts series, we have Dr. Peter Forsberg from the Colorado Blood Cancer Institute. He's someone that has a unique perspective. He used to be in academics and recently transferred to a large community practice that does still pioneering work in research. And so he hopefully can give us an inside scoop on how he's bringing bispecifics into a more of a community setup. So from the ivory tower to Main Street. So welcome, Peter.
Yeah, thanks, Robbie. Appreciate you having me, and happy to talk about it. I think this is one of the more kind of really exciting and important topics for us in the current myeloma landscape. Is how do we take these great treatments and how do we get them to more patients by getting them into community-based settings?
Yeah, I think that, these have been around for nearly, 2 years. And I think that the uptake in the community has been much slower than anticipated. And these are, as you said, really great drugs. And we need to have more patients be able to avail of these. So just to set the stage, I think, could you tell us about what are the bispecific antibodies that are approved in multiple myeloma?
Yeah, so in myeloma, we now have four approved bispecific T-cell engagers, three that have a similar kind of, approach, basically three that target BCMA, that would be teclistamab, elranatamab, and linvoseltamab. So those are our BCMA targeting bispecifics. We have one talquetamab that targets GPRC5D. And essentially what these do is, bind to the myeloma with a specific, antigen that they're targeting, and then they bind to CD3 on T cells, bring them close together, activate the T cells to kill myeloma cells, all four of the bispecifics were initially approved in a very similar setting, late relapse myeloma. Only over the past few weeks, we actually have our broader approval of teclistamab, which, is our first bispecific to now move into the early relapse setting, approval of the Majestic 3 trial, which was teclistamab plus daratumumab in patients with one prior line of therapy, is really going to dramatically expand the number of patients who are appropriate for this. And hopefully it'll be something that helps to, encourage that sort of progress that we know has been unfortunately kind of slow in the late relapse setting in terms of moving from, approvals of these really effective tools into accessibility.
So obviously, you said there are three approved, and initially for later line therapy. One of the things the community docs are going to want to know, there are three approved for the same indication for, at least initially for the same lines of therapy. Is there much